I was like, you're not supposed to have favorites, or you're at least not supposed to say that you have favorites, but really all three of these people, I was so excited, so don't tell anyone else. Dan Kramer, very good friend and colleague in the past. He is here representing his own personal caregiving story and also is here representing Jack's Caregiver Coalition, which I've been involved with for many years. We're so glad to have you here. Deb Laxon. Deb and I have worked together for years and years on the Minnesota Cancer Alliance. It's so good to have you here, and you are here also not only as a caregiver, but to talk about the gray zone. And Pam Mason also worked with you forever and ever and ever, and it's so nice to have you here to share your story as being a caregiver and your involvement with the American Cancer Society. So I'm going to turn it over to the three of you. When we met to build this content on what this looked like, I had shared that I wanted this almost to be a conversation as if you three are sitting at a coffee shop and all of us are at another table and we're eavesdropping on this conversation with three caregivers who are involved in the caregiving community, and certainly want all of you to feel engaged and part of this special conversation, and we'll give time at the end for some questions. Thank you.
Thanks, Sarah, and hi, everybody. We're going to have a conversation, but with microphones, so it's a little awkward. Sarah said, my name is Dan Kramer, and I'm here today representing the Jack's Caregiver Coalition. Jack's is an organization dedicated to supporting and helping men improve the way they think, feel, and act at every stage of their caregiving journey. And we define the caregiving journey from the moment they start as caregivers to well after their loved one dies, and so we try to provide support through that entire journey. More importantly, probably for today's conversation, though, I'm also here as an active caregiver for the love of my life, my wife, Cassie, who was diagnosed with early stage breast cancer in 2002. We got it treated, thought everything was fine, and then 16 years later, it came back as metastatic breast cancer, which sure all of you know is a treatable but not curable disease. She's doing pretty well. She's about to hit the 5-year mark, which we never thought we'd see. But that journey from when she was first diagnosed and the utter devastation we both felt and the sense of feeling completely lost. And for me, as her caregiver, not knowing where to turn or what to do or what even that meant to be a caregiver. And that's how I was introduced to the Jack's Caregiver Coalition with a pamphlet at her oncologist's office. I'll talk more about what I do for Jack's and what I've learned from them, but that's really been my caregiving journey. And I should also say Cassie and I blog about her cancer journey and its impact on us as a couple. We found that there were a ton of resources for her as someone who had cancer. There were a fair number of resources for me as a caregiver. There were almost no resources for us as a couple. How do we navigate this as a couple? What's it going to mean for our relationship, for our changing roles? And so we blog, and you can find our blog at meaningandstuff.com. And if anyone's interested, I have little cards with that afterwards I give out. So that's just a little more about me, and I'm super excited for this conversation.
Good afternoon, everyone. My name is Pam Mason, and I work at the American Cancer Society. I'm Associate Director of Cancer Center Partnerships. And you may or may not know that the American Cancer Society is a national organization where we are committed to optimizing the quality of life for patients and their families who've been impacted by cancer across the entire cancer continuum. And that starts with prevention and early detection, screening efforts through diagnosis, treatment, survivorship, and end-of-life care. And we go hand in hand with our advocacy arm, and that's the American Cancer Society Cancer Action Network, where we educate lawmakers on why policies are so important that impact cancer patients and why it's so important that they support those legislative things that we are trying to pass. I've been at the American Cancer Society for 10 years and have truly appreciated the work that I and we at the Society have been able to do from a broad standpoint. And I would say on a on a personal level, in the role that I do, I don't oftentimes work with the patients and the caregivers. And so I started caregiving on the side in 2017, where I got to serve as a caregiver for patients with cancer, dementia, Alzheimer's, Parkinson's disease, and I felt like that was giving me the skills and the additional empathy to try to better understand what someone with cancer was going through. I served as a virtual caregiver to my two uncles. One passed away from lung cancer on Thanksgiving a couple years ago, and one is going through it now. And now I'm a caregiver in a different way. My son in 2021 was hit by a hit-and-run driver and was left blind, nonverbal, and quadriplegic. And he was just 19 years old. And so I really, truly understand now when we think about everything that surrounds a caregiver, what that means. And so that's why I wanted to kind of share my story today and how ACS can hopefully help you, your patients and caregivers and other loved ones.
Thank you. Thank you for sharing. I'm Deb Laxon. I am past the caregiving journey, but it impacted me in ways that I never expected. My late husband was diagnosed with terminal cancer in the emergency room. We didn't know he was sick. And so I was suddenly thrust within a minute into a caregiving role that I wasn't expecting and wasn't prepared for. And was a caregiver for 2.5 years while he went on his journey. And then what I learned was there's a significant difference between being a wife, a caregiver, and a healthcare agent. I was all three. And depending on the question asked and when it's asked, you have to put on a different hat. You have to remember you're the healthcare agent. The wife and caregiver are designed to keep the patient alive at whatever the cost. The healthcare agent has to understand what the patient's wishes are and make sure you honor their wishes, which may mean saying no and allowing that natural death. So that, he died in the intensive care unit, and one of the first and the only decision I made as a healthcare agent officially was to allow and authorize the removal of life support. Sarah mentioned the gray zone. After his death, about a year after his death, I'm going, people don't understand there's a difference between a caregiver and a healthcare agent. So I wrote the gray zone, which is the gray zone when life support no longer supports life, trying to explain what the difference is. A few years ago, I wrote another book called The Fog Zone, Navigating the Space After Your Diagnosis, because what I'm finding is we need to have the conversations about end of life earlier when it's not end of life. We need to talk about serious illness, and certainly when you have a cancer diagnosis, start those conversations early and repeat them, assess every so often. I ended up quitting my job, opened my own company called the Healthcare Agent Literacy Project, and I'm surprised at all of the places and the summits that I go to where we hear about caregivers, we don't hear about the unique role of the healthcare agent. So we need support for the the caregivers, and certainly I didn't know what I didn't know until I knew it from experience. And I'm thinking I want to help other people learn sooner about that. I'm also not only on the Minnesota Cancer Alliance Steering Committee, but I'm vice chair of the Minnesota Palliative Care Advisory Council. I'm trying, along with many other people, to make changes at the policy level so that caregivers get the support they need, and healthcare agents as well.
Maybe a place to start is the things or some of the things that caregivers are facing. That's not okay? So the primary role I play at Jack's is I lead our monthly discussion group, and I love these groups. We call them caregiver clutches, and they're multi-gender. We often have between 8 and 14 caregivers, and we meet somewhere that everyone who's there can get food and something to drink if they want. And, you know, after introducing ourselves, the format is that every caregiver gets to nominate as many topics as they want, whatever might be on their mind to talk about. And it can be 1, it can be 5, it can be 7, and we put them all up on the wall, and everyone gets like 20 seconds to say why that was important to them, why it was on their mind, and then everybody in the group gets 3 votes. And you get to go vote for what you want to talk about. And then we talk about those things for 8 minutes. And then we decide as a group of whether we're going to talk about them for another 4 minutes. And we can keep going. The longest I've seen something extended is I think we extended one topic 4 or 5 times. But it's a beautiful format because often I go in with the topics that are on my mind, and I almost never vote for my own topic. Like I wind up hearing from someone else, I'm like, ooh, I need to hear about that. So I just did a scan of some of the topics from the last 6 months that were nominated. I'm gonna just share some of them, and then maybe that can be a jumping off point for us. So coping, being in the shit, these are in the participants' own words. Anxiety, stress, depression, anger, self-care, dealing with doctors, asking for help, communication, money, asking for help, communication, death, hard conversations, self-care, receiving help, death, communication, asking for help. You're probably getting the idea here. So those are just some of the topics, and literally it's on and on. So I think those are the things that are, and many others that are on caregivers' minds, which begs the question of like, okay, so how do we support caregivers in that?
I like the asking for help. My late husband didn't like to ask for help. And we moved from our house out in the country to a house in town where it was closer to the hospital. And in my neighborhood, they had lots and lots of community get-togethers and picnics, but no one knew he had cancer because he didn't want anybody to know. He didn't want to be defined by the disease. So it left me isolated. He didn't want help. I couldn't ask for help because asking for help violated his didn't want help and violated his privacy. So I went through the journey with him, but isolated and never asked for help. So that's one of those. I think as caregivers and patients, we overestimate our ability to heal, the patient's ability to heal. Of course they're going to get better. We have fantastic doctors. They can fix anything, but they can't. So we overestimate the ability to heal. We underestimate the effort required to keep things afloat. We hate to ask for help. Another common theme seems to keep going. We don't know how to ask for help. We don't know how to accept help. But we know we need to know because we need a realistic future. But we need to be able to hear the realistic future. And then grieving after death takes much longer than you think it does. And many of the check-ins only go for maybe a year, and it's a mailed thing, how are you doing? And it's like, I'm still crying. I'm glad I'm a remote worker because I can shut the camera off and I can pull it together and nobody knows. So I can hide it really well, especially when my adult kids all live out of state.
I will talk about communication and death too, and just feeling overwhelmed. You know, when Austin's accident happened, there were so many things surrounding him. You know, being comfortable. You know, the medicines that he was on and the side effects from those medicines. And as a caregiver, you feel like there's so many things that you need to be mindful of, but you don't know what you don't know. You don't necessarily know what to look for. And so then you have this fear of, what if something happens and I don't catch it when I'm there with him. And so there's that fear, and then there's, the care that you want your loved one to have in terms of, the bathing and the dressing and the grooming, and you just want to make sure that those things are being done because you want, your child to have that sense of dignity, and you want to make sure that the healthcare staff respect that. I know there's such a shortage of healthcare staff, and I want to respect the fact that they're busy, but also I've learned to be an advocate and making sure, is he being, positioned as often as he should be? Is he, has he been checked lately? Has he been changed? And there's the grief thing. It's one thing to grieve someone that has literally passed. It's another thing to grieve someone who is still with you. And so I think caregivers need to reach out and ask for help. They need to be an integral part of the care team and make sure that their voices are heard and advocate for their loved one.
One of the things that makes this so complicated is certainly true for Jax, where mostly who we serve are men, and we did a survey a few years ago, and 78% of the men reported not having any help as a caregiver, which is mostly tied into this, it's hard to ask, and it's also hard to receive help, right? So I think both ends are challenging, and one of the things that I've observed is there's different stages of this caregiving journey. So there's the post-diagnosis stage, immediately after diagnosis or accident. There's then what I would think of as kind of the learning and settling in stage. You're figuring out what it means to be a caregiver, you settle into that. There's the active dying stage, and then there's the post-death stage. And I think you need different help at all those different stages, and you don't always, since you don't know how to ask for it, what I found really helpful is when people offered things. So when people say, what do you need as a caregiver? I say, well, first of all, just check in. What I really need is to not be alone, to just send me a text. And, as I got more confident, I would say, well, what are you available to do? And then that actually takes it off of the caregiver, this pressure of, oh my God, what do I need help with? And, oh, do I need someone to do shopping for me? Do I need someone to come over and do yard work? Do I need connection to legal resources? So I think one of the concrete things people can do to help is offer to do specific things rather than saying to the caregiver, well, what do you need? Because if you're really, shitty at asking for help or taking help, which I am, then you don't know how to answer that question of what do you need. But if someone says, hey, could you use help getting weeds out of your yard? Well, I know the answer to that question. For sure, I could use help with that.
Yeah, as I was trying to reach out for help, I read about how just, make a list of those things that you need to have done. So when people ask if there's anything they can do, you can say, well, actually, there is. And I think that this is a good segue. I'm going to quickly talk about a study that ACS is doing in partnership with Masonic Cancer Center, University of Minnesota, and Wilder Research. And we are going to be holding focus groups towards the end of July and early August. And we want to meet with caregivers, a diverse group of caregivers. So that doesn't necessarily mean, people of color, young and old, married, single, because every caregiver experience is unique. Everybody has a caregiver journey with someone with cancer, and that changes along the cancer continuum. So we want to better understand what are some of those unmet needs. So when we know that there's mental anguish, and there's like physical needs that a caregiver will have, and we know that there's like financial toxicity, but there's also like an area that's not as well explored, and that's unmet. Those are unmet needs, and so we want to hear from a diverse group of caregivers to better understand what are those themes, because ACS as a national organization, where we have national partners, what if we could understand those themes and connect caregivers to service providers who could potentially come out and perform a particular service at a reduced rate because they got the referral. We know that respite care is one of the most requested things that caregivers ask for, but we know respite care can look and mean different things to different people. It could be, just getting away from the caregiver situation just for a little while. It could be going on vacation, but it could be, gosh, if I just didn't have to do this and this and this, right? If I could just check that box and not have to worry about that, that would be wonderful. So I do have recruitment flyers over there. They're for different populations, and so if you could help spread the word, that would be wonderful, because again, we're trying to see how we can help caregivers in addition to, and I'll talk about this more in a few minutes, but in addition to the resources that we have through the American Cancer Society.
Thank you. As part of the Palliative Care Advisory Council, we look at the patient's medical needs, the patient's supportive needs. Can they perform self-care, ADLs? Can they still interact with their environment, the IADLs? Can they go shopping and those kind of things? And then what's unique about palliative care and so important is that they are there also to support the caregivers. And we are in the process of pushing and defining what that might look like for the state of Minnesota. One of the tools that is out there for a caregiver, it's called the ZARIT Burden Tool, Z-A-R-I-T Burden Tool, if you Google that. And what it does is assesses in 22 questions, tries to get at the heart of where the caregiver is. So obviously you could see it either improve or decline as time goes on. As Dan has pointed out, the caregiver needs change. So that's one way to do it, and also I think the longer caregiving goes on, the more hyper-aware you become of a caregiver as to where the patient is. I know as a remote worker, I could tell how sick my late husband was, whether he was out in the garage, whether he was in his downstairs office, whether he was watching TV, or whether he was in the bedroom watching TV, or whether he was in the bedroom with the TV off and the drapes pulled. If he was in the bedroom in the middle of the day with the TV off and the drapes pulled, I had about 2 hours, maybe 3, before we made an emergency run in most of the cases. So then I could start to wind down the calls at work and say, I'm getting ready to go. But that's exhausting. That hyper-awareness, where are you, what are you doing, and it's going to impact me. So I need help, but I didn't know I needed help. Again, asking for help.
So at the American Cancer Society, we have a variety of resources specific to caregivers, but I will say that all the resources we have for patients can also apply to caregivers. It's important that caregivers are aware of what we have in case the patients don't. So, for example, we have a 24/7 cancer helpline, and that is available not only 24/7, but 365 days throughout the year, anytime, day or night. And so it's very comforting to know that there's someone you can talk to. Oftentimes, as caregivers, caring for a loved one with cancer or anyone that they may be having to care for, sometimes you feel like you don't want to necessarily talk to your family sometimes, because you feel like I know with like my son, for example, who's my rock. He's 16 months older than my son who was in the accident. There's sometimes I want to talk to him, and I don't, because I don't want to upset him. And so I feel like it's sometimes hard to talk to my family members. And then sometimes I don't want to talk to my friends because I just feel like I don't want to bring them down, and sometimes it's even hard to explain, as I'm trying to explain to you here. So I think it's beautiful that we have like a 24/7 number. And if trust me, they've heard it before about whether it's, just day-to-day questions that they have, whether it's programs and services that we have. Like we have a Hope Lodge, for example, and we have one in Minneapolis and we have one in Rochester, and that provides a free place to stay for patients who are in active treatment. That said, special accommodations can be made. So we always encourage one to reach out to the managers at our Hope Lodge to see if their loved one could be a fit for staying at the Hope Lodge, and caregivers are able to stay at the Hope Lodge too. And so sometimes patients don't necessarily find out about that existing. We have a Road to Recovery program, and our volunteer drivers provide transportation to people who are needing to get to their active treatments appointments. We hear a lot about financial toxicity, but as a caregiver, you're faced with time toxicity and logistical toxicity. And so I know personally it's like I do want to try to be the one providing all that care, but sometimes you can't, and there's some caregivers out there that don't have family and they don't have friends, and so being able to be aware of a program like this, perhaps it could come in handy. We have resources on, a particular type of cancer. If your loved one has been diagnosed with a particular type of cancer, what is this type of cancer? What questions should I be asking my doctor? We have a cancer support network. It's an online community that contains a variety of cancers, and caregivers can go on there and learn about those cancers and hear from patients with that particular type of cancer to try to better understand maybe what they're going through. And there's a caregiver section on there as well where people can, you can either participate or just kind of read and kind of relate to and learn from what others are going through as well. We have a number of books, for example, and so this one is called What to Eat During Cancer Treatment. So when my uncle was going through lung cancer, and they're in Virginia, and the other one's in Texas, because we talk about virtual caregiving too, I sent them this book. And I said, depending on the type of symptom that one may be experiencing, whether it's like nausea or constipation or just, there are tips in there. So for example, if it's hard to get down and shore, put it in a tumbler, make sure it's cold, maybe put a cover on it. If, smells due to treatment are affecting their ability to eat. And so this just skims the surface of what we have, but I wanted you to know that some of these resources exist. So, thank you.
You guys are doing great. I haven't needed to facilitate yet because it's great for you guys to talk and share amongst each other. One of the things that I'm curious as we can use the audience of attendees here, whether they're with local community organizations interested in the cancer plan and helping reduce the burden of cancer, or in health systems, what does caring for the caregiver look like in a community setting? Dan, you obviously spoke to Jack's, Pam, you spoke to American Cancer Society, but when you think about your role as a caregiver, what has that looked like, if you can kind of remove yourself also from the organizations and areas you're involved with?
That's a tough one for me to answer, because as a caregiver, I didn't reach out because, again, it was an invasion of my husband's privacy to reach out. So I did solo.
I would say, if I'm stepping outside of ACS, that just being, making sure that you are a part of that care team, and there is sound communication. I feel blessed that my care team asks about me and how I'm doing and how they can help. Oh my gosh, I lost my train of thought. I'm so sorry.
No, I mean, you actually, we can just have a conversation too, but
yeah.
Pam, what you just said though about feeling heard, that your son's care team is asking you how you're doing, that's a huge step and a large piece.
Thank you. I know what I was going to say. I'm sorry. There's that fear of the unknown, and so one thing I really appreciated when my son and I were in Chicago, we were at the Shirley Ryan Ability Lab, is that they had a caretakers in training program, and so when I think of health systems and I don't know if this exists in the cancer space, but I got to meet with social workers and the OTs and the PTs and the speech language pathologists, and I was asked, like, what are your goals in terms of what do you want to learn so you can help be a better caregiver to your son? And so we were there as part of a 4-week program. So we were there for part of a 4-week program, and I got to identify some of the goals I had because I was so scared about, he wasn't progressing fast enough to warrant insurance to extend his stay there. And so then it was like, okay, what's next? And that scared me so much because, I didn't know about administering meds. I didn't know how to, clean around a G-tube. I didn't know about bed sores and vitals and just signs of something that was to come. And so, and I also didn't know how to change someone who couldn't move, really. So I appreciated the care team wanting to understand what my goals were each and every week. And then like a speech language pathologist would come and she would say, here, okay, this is how you can work with him to practice swallowing. I had an OT come in and say, this is how you can help change him. I got assistance on, using the bed chuck to try to pull him towards you because he's a big guy. He's way bigger than I am. And so when I think of myself as a caregiver, we have videos online, for example, on how to drain a port, how to look for side effects of someone who's undergoing cancer. But for me, getting that hands-on was so important. And so I don't know if that's something that health systems provide, hands-on training for the caregiver. It really helped me. And there's still so much I have to learn. So.
Thanks for sharing. I'd say for me, the things as a caregiver that I most need, and I alluded to one of these before, is contact and connection. Like, it's really lonely. And it's especially lonely when you're not in the crisis mode. So like post-diagnosis, or like everyone wants to know when, do you have a scan schedule? I mean, there's always a scan scheduled. But it's like in between those moments that it's really lonely because your friends, your family, your community is really good at responding to a crisis, but it's unrelenting for both the patient and for the caregiver. So I asked Cassie as I was leaving, I said, what do you think caregivers need? And she said, they need to be seen. That it's real easy not to see the caregiver and just see the person who's suffering from the disease. And of course they're suffering more, but the caregiver's suffering too, and it's as relenting for the caregiver. And I'd say the second thing that I've really needed, and this is probably the second most talked about topic in our discussion groups is I need time for self-care. Like I need time away from being an active caregiver to make myself a better caregiver. And that's really hard for caregivers, this topic of how do you take time without feeling guilty? How do you claim time for yourself? And especially if you're balancing caregiving and working and, you know, raising kids or supporting an elderly parent or all the other things in life that you're doing, how do you take time, you know, for yourself? And so especially when Cassie's not doing well, like I need people to come be with her so that I can go take time for myself. And I need her to say, it's okay, take time for yourself. Like, go do that. Go see your friends, you know, work out, do whatever you do. And so that's something caregivers often need, you know, from the caregetter, is some of that permission to engage in self-care.
And speaking of self-care, I need the medical team to make sure as a caregiver I'm not delaying my care. So, for example, my late husband was in queue to get a stem cell transplant, and he needed a permanent caregiver to go down to Mayo with him. And I went in to get my annual exam, and sure enough, I triggered the cancer screening. And I'm having a conversation with my gynecologist it's like, okay, ovarian cancer, okay, what do you need? Nope, you can't do a hysterectomy because then I'm bumped out of the queue because I can't lift and I can't meet the minimum physical requirements. My husband is sicker than I am. His comment, you have a probability of living longer than he does. So we're having to decide, is his care more important than my care? And whose life is more important, which is a really sucky place to be. So I kept negotiating with him, and we ended up doing the minimum needed, which was not the full. And then I was able to be the caregiver, but make sure I'm not delaying my care, because my doctor would not let me delay for 9 months, because by then it could have been too late for me.
I think that's so important. Thank you for sharing that. It goes a step further. I've used the word advocacy a lot today, and that balance between advocating for yourself to your loved one, trying to balance out being protective, all of those things, getting permission. What does all of that look like? And it's a lot. I am so thankful the level of vulnerability you are all sharing with us. One of the things that I think about those doctor's appointments too, whether it's your own physicians or your loved one's physicians, is how important it is for the care team to ask these questions. I feel like I'm a little bit of a broken record there. We can't expect us as the patient or us as the caregiver to ask the questions, because there is feelings of isolation or feeling as if no one has said that this has happened to them before, so it must only be me. So what is our responsibility as the healthcare team to make sure that we are being forward, that we are comfortable being uncomfortable? Because if we are here to serve the caregiver and patient, we oftentimes are going to have to lead with those questions or resources or examples to help the caregiver open up.
I'll take it a step farther and make sure you ask the questions periodically to the caregiver alone, so that they are not influenced by admitting in front of the patient, I'm vulnerable.
Yes. I know too, speaking with caregivers, not only the physician speaking with the caregiver alone, but having some type of an agreement on how can I bring up hard subjects on behalf of the patient, the person I'm caring for, in a way that doesn't feel disrespectful for them, but needing more guidance, or trying to provide advocacy, though, in a safe space that's not done in that triangle of that triangulation of support. I want to pause quick. I appreciate the engagement. This is one of the things that I love about being together, that I can see heads nod and validation. That way I can see all of you resonating with Deb and Pam and Dan really well. Are there questions here, comments, conversations that can be had all three of you working closely with organizations that can help move the needle forward for caregivers, but also your own journey. Would love to open it up.
One thing I find is that when I go with my mother, who was perfectly healthy till last fall, is that when I go with her to her appointments, she's 92, the doctor always talks to me and not to her, and she just gets lit. You know, she's like, I'm not in a nursing home. I pay my own bills, you know. But they always focus to me. And that is, and then people will call and say, oh, hey, your mom's got a prescription. Or, oh, does your mom want to give to this? Or does your mom, and I'm like, so finally I've said, no, call her. She's of sound mind and body. But how do you get away from that? Because I'm taking her or going along with her to be an extra set of ears, she gets no more respect, it seems like. It's like out the window that they only talk to me because I'm younger. And that's really difficult. And now she is sick with stage 4 cancer, and so I tried to, distance myself. She does lie to her doctors all the time, but, I was just like, well, it's your journey, not my journey, so if you want to lie to them, have at it at 92. But, we're not going to change that. But I just think that's a really big thing that's overlooked is either have a separate conversation or something, but talk to the patient.
Thank you for saying that. And the three of you, have you experienced that as a caregiver? And if you have, what have you done to help?
I have.
Yeah, we did a little, and I mean, we're at a different life stage. We were aware of some, not surprising gender dynamics where I was in the room and the professionals would often talk to me. So like our solution to that was really easy. Like I stopped going for a while. And Cassie's like, I'm in charge here. And so she and I would meet before every appointment. We have a book. We can each write questions in the book. She promises to get my questions answered. And so that's the phase we're in now. And we can imagine a phase where I'll resume going with her. But that was our answer to that was I just removed myself. Actually, she removed me from the equation, and that's really working. Though we did have a navigate. How do I get to still have a voice in this as the caregiver?
Can I ask just from a medical professional? I'm not in the clinic, but I can imagine, and I work with plenty of clinicians who would want to know that they are doing that, whether it's an intentional or unintentional. Was there any conversation between you and Cassie about saying to the person that is indirectly talking to you?
She gave him a lot of feedback on
Okay. Well, good. That's good. Because I think that that's an important piece, too, is our medical providers, I think, they're constantly learning and providing that feedback and educating them on how to be better at their work and more aware of internal biases is super important. So
Thank you. Yeah, there's there's conversations that on a systems level that we can do. I know that we had talked about that in the survivorship breakout. What can we do in institutions to bring this forward before having to wait for, the ombudsman department and feedback to come from a patient who is upset or a caregiver that doesn't understand why they're being spoken to and not the patient. So thank you for asking that too. Other comments?
Hi. I work with a team of nurse navigators who work with patients and families and caregivers. And a lot of what they do is connect people to resources and services, whether it's inside of our health system or outside all of the wonderful organizations that are here today. For caregivers, do you guys know of, are there any documents or places online or things that you guys have gathered over the years in your respective organizations that is like a hey, here's a one pager about like some really amazing things that you guys might like, or here's a book, or here's, is there anything like that? Maybe, or like if Jax has anything, if a new member comes, like, I'm just wondering, that would be such a rich, important piece of paper or, information that you could give to someone new or down the road. I know we have that Minnesota Cancer Alliance document that shows all the wonderful organizations, but I just think that's where sometimes you can get that really wonderful tips and tricks from people who have walked in those shoes. Do you guys know of anything like that?
A couple things. ACS does have a list of caregiver resources, national, and now we do have the ability to provide local resources. You may recall back in the day that was something that we had, and then we kind of had to do away with it for a variety of reasons, and we've brought that back so we can, when people reach out to the society, that they are able to get national and local resources. And then I know that the Angel Foundation, that they had put together a list of caregiver resources, and they had sent it out following a webinar. But that said, I don't recall it being in a one-page format. I want to say it was like an Excel spreadsheet, but don't quote me on that. But where I'm going with this is we could possibly see if we can get that in a one-pager that could be distributed, perhaps.
Not a one-pager, just something, would be a nice resource.
Yeah.
Because sometimes, the dosing of information like that is hard. So for our team, it's like, okay, well, maybe right now is not the time where I'm going to tell them about this or that, but maybe when we talk about that in a couple months or maybe a year out, or so I think just having something where a patient has access to that and can sort of review it and say, oh, this is something that I'd like to learn more about or that I'm struggling with, or a caregiver, for example, might be really nice. It doesn't have to be a one-pager, but.
Keep it electronically and then have like a QR code that, is included in the patient information, and then at any point, because you hate to have them wait until their next appointment, right, or until they can get a response. They need the resource now, and then they can, QR codes are coming back.
Yes, QR codes are coming back. One of the things that I was thinking too, and I know quite a bit about Jax and have worked closely with them. Jax had created an animation video last year, so maybe this is something that Minnesota Cancer Alliance that we can link on our website, and maybe that's also a takeaway piece, so put this on your feedback. I will also make a mental note. This maybe could be a takeaway place of on the Minnesota Cancer Alliance website, we create a portal or a tab just for caregiver resources, making sure that the state brings together all of the organizations on what we're doing, and we can keep those documents there. That being said, Jax had created an animation video last year as a way that to solve a problem of when people ask, what is it that you need? And then it just feels paralyzing and everyone's asking and you either feel bad about answering, like, I really need you to clean my cat's litter box, but like, does anyone really want to do that? So I'm just not going to say it. And then you feel overwhelmed and then alone. What does that look like? This video was created as a way for caregivers to send out the video, and I think it's 90 seconds, to send out a video and say, learn more about a caregiver role. And as a male caregiver, what I need and what that means to me, especially talking. And it gives like really fast just bits of information so someone can watch this on their phone and think, great, I can make the forward step. Dan, the other thing that you said, and in almost 20 years I've never heard that, and it's so powerful, is when you mentioned someone asking, what do you need? You asking them, what can you give to me? Because I really do think that that's one of the most paralyzing questions to contend with, and knowing. I've found myself saying, I don't even want to ask the cliche comment, but what is it that I can do? And just not even knowing and trying to imply thinking that you can or cannot do something, but really trying to shift that conversation and turn. And I do know that I believe Jax has a document that has 20 to 30 suggestions on what other people can do for the caregiver. So really trying to be proactive and having those resources there. Other questions?
So healthcare is just getting so much more complicated, not just as a patient, but as a caregiver. I've heard talks today about financial literacy and the health agent literacy and caregiver literacy and all the things you have to know to function. It just feels overwhelming. And so I feel for you, Deb, being in a situation where you had no time to adjust. Is there any space for pushing this education to a general population ahead of time so that there's more knowledge beforehand? Not that you're ever going to know how to flush a port or do wound care or navigate the intricacies, but raising the literacy generally so that there's less of a leap when you find yourself, if you find yourself in that situation.
Yes, and that's why I am such an advocate of palliative care. If we do palliative care effectively, you will get introduced to it right at the time of the diagnosis and the prognosis. And then again, depending on the openness, so you would get a referral and then you would be assessed as to your need, whether it's a tier 3, a low tier, a moderate tier, or a high tier. And then that information is assessed and pulled and pushed at the same time so that it's a time-intensive conversation, and it's pushed to the palliative care team rather than the treating physician. They concentrate on treating the cancer. The palliative care team steps in and takes the time to ask, what do you need? Where are you at? How are you feeling? Whether it's to the patient, whether it's to the caregiver, and it's what resources do you need? How are you doing with the ADLs? And how is the pain and symptom management of the disease for the patient? So there is a time, and in my opinion, and learning more and more about palliative care, we need to expand palliative care in Minnesota, and that's what we're working with and for with the council.
The only other thing I'd add, I had a friend die earlier this year of cancer, and I was unexpectedly asked to speak at his funeral. And then I talked to his wife, and she said it was one of his last wishes, and he'd like you to talk about cancer, death, and dying. I was like, oh, okay. But the one takeaway I brought into that was, like, we're just really bad as a society about talking about these things, like talking about sickness, talking about illness, death, and dying. So I think one of the things we can do to get ready for it is we can just talk about it more. We can model it more. We can be in it. So I've been thinking a lot about how do we all, whether we're healthy or sick, how do we all live fully while preparing to die? And what does that look like now? So my friends, like, I talk about death and sickness and dying with them all the time, probably to the point that they're sick with it. But, like, they're now more literate in that. And so I think we can all help others become more literate so that when we're in that crisis situation, it's not as foreign to everyone. Because I think one of the reasons people don't engage and become so lonely is they just don't know what to say. They're so uncomfortable talking about it.
Deb and Pam, final comments to Dan. Thank you. That was so important, and I appreciate your friend for being forward, thinking we need to talk about this, and you being the vessel and the teacher.
Yeah, I will say that it has enabled my son and I to talk about death more openly and living life to the fullest, not sweating the small stuff. And it has now made me go, boy, have I learned about the legal system and a lot of things you mentioned during the financial toxicity session. But I've got things in check now. So it's made me be proactive in wanting to make sure if something happens to me, Austin's taken care of, and Ryan has too. And those conversations are hard. Ryan's like, I'm only 22. But it's you never know. I mean, life can change like that in a heartbeat. And so I just want to make sure, I want to try to protect him from going through, I just want to try to protect him. And so he's, to minimize any stress he may have in the future.
And it is those proactive conversations. I experienced the people who just said, I don't know what to say to you. Your husband is dying. What do I say? I'm not used to talking to somebody who has death staring in their face all the time. So they leaned out. You need people to lean into these conversations. And so I have the tough conversations with my kids who are now my healthcare agent. My two youngest are my healthcare agents. This is exactly what I want. This is what I don't want. And under no circumstances, let them talk you into this. I want to make sure that they understand that care is a choice and no is always an answer. There are times when no is the right answer.
Thank you, all three of you. I'm so grateful to know you and have you in my life and have you represent as a caregiver and the wonderful organizations that you're involved with. So thank you for being here, and thanks to all of you for bringing your questions and sharing your comments. We have our final speaker, Dr. Kamal, who will be on stage momentarily. We hope that you enjoy the last hour of the summit today. Thank you.